Libido is the name of the game today.
It's all about libido.
Yeah.
This might be embarrassing for you. Look, it's already embarrassing for you.
I don't know why it would be.
Okay.
I think pretty much every patient I see, certainly annual exams, and I see how they're doing over time, I ask them about libido as well, as just as I might talk to them about how well they're sleeping or how energetic they're feeling or whether everything's working and so on.
And how long have you been doing that? Forever or really just more recently?
Oh, probably the last 10 years.
Okay.
And it's quite often that patients are concerned that they don't feel that they have much libido and they're tired and it's maybe too much bother to try to have sex.
Yeah.
But a lot of people just feel better or want to improve their libido. And one of the reasons for people having decreased libido, particularly postmenopausal patients, is that things don't work very well, that there's dryness and pain, and they certainly don't want to do something that's going to cause them discomfort. But for those where everything is okay, or those problems have already been addressed, like everything's now working, they may want more libido. And so that's when we can use some hormonal help. Testosterone is a frequently prescribed hormone for men and for women to increase libido. Yeah. It's not FDA approved for libido in women, which is quite remarkable, as though you would think the FDA is saying they don't need it, or why should they want it? One of those other examples of how poorly women's health is dealt with. Nevertheless, compounding pharmacies can compound a combination of hormones to help women with libido, and specifically testosterone. Very safe for women. We're not getting up to high blood levels, but we are increasing them above levels that are considered the norm.
Yeah, which is great.
And it can be, it doesn't work for everybody, but it gives them strength, energy, and it improves their interest in sexual activity. Another hormone that can be used is oxytocin. And that is sometimes referred to as the friendship or the comfortable hormone, where it increases a feeling of well-being and let's say just intimacy, not quite as aggressively as testosterone. And this can be used also as a compounded cream or as a nasal spray, and really is, for some people, very helpful. Again, men can utilize the oxytocin, and if we're using testosterone for men, we're more cautious because we're going up to higher levels. But again, topical creams work really well. Injections also are probably the most economical way to get testosterone. And patches are available for men for testosterone. Again, all of these can help. They're not guaranteed to help, but we've got certainly some things that can be used, and patients should be aware of that.
Great. Thank you.
Here's to your libido. Well, thanks for listening. We're getting really good feedback. We'd really appreciate a review on Apple Podcast, Spotify, or wherever you're listening. Thank you. You can always DM the Vagina Doctor Instagram with any questions or topics you'd like to learn more about, or email us. The Vagina Doctor Podcast. It all starts here.